Imagine waking up tomorrow morning and standing up from bed without that sharp pain shooting through your lower back. Imagine bending down to tie your shoes without wincing. Sound impossible? Well, what if I told you that a simple mineral deficiency, something affecting nearly 75% of Americans over 60, could be the real reason your back pain just won't go away? And here's what's truly shocking. Your doctor may have never tested you for it. In fact, many doctors don't make the connection between this mineral and chronic back pain, even though the research has been staring us in the face for decades. Stay with me for the next few minutes, because what you're about to learn could finally give you the relief you've been praying for. Hello, my friends. If you're over 60 and you've been dealing with nagging back pain, the kind that makes getting out of a chair feel like climbing a mountain, or the kind that keeps you up at night no matter how you position your pillows, then this video was made specifically for you. I'm talking about that persistent ache in your lower back, that stiffness in your spine, maybe even that pain that radiates down your legs. You've probably tried everything: heating pads, pain medications, those expensive ergonomic cushions, maybe even physical therapy. And sure, some of these things help for a little while, but then the pain comes creeping back. Here's the truth that nobody's talking about. Your back pain might not actually be a back problem at all. It could be your body's desperate way of telling you that it's starving for one essential mineral. And when you finally give your body what it's been missing, the results can be nothing short of remarkable. Today, we're going to talk about magnesium, but not in the way you've heard before. We're going to dive deep into how this miracle mineral can transform your spine health, reduce inflammation, and potentially end your chronic back pain for good. Now, I know what some of you might be thinking. Magnesium? Really? That seems too simple. And you're right to be skeptical. We've all heard miracle cure claims before, but here's why magnesium is different, and why the connection to back pain is so powerful. Your spine isn't just bones stacked on top of each other. Between each vertebra, you have these cushiony discs that act like shock absorbers. You also have dozens of muscles, tendons, and ligaments working together to keep everything stable and moving smoothly. Here's where magnesium comes in. This mineral is absolutely essential for over 300 different processes in your body, and several of these processes are critical for spine health. First, magnesium is crucial for muscle relaxation. You see, your muscles need calcium to contract, but they need magnesium to relax. Think of it like a lock and key system. When you're deficient in magnesium, your back muscles can't fully relax. They stay in a constant state of tension, like a fist that never fully opens. This is why many people with magnesium deficiency experience those painful muscle spasms in their lower back. You know the ones I'm talking about, those sudden cramps that make you freeze in place, barely able to breathe. Second, magnesium plays a vital role in reducing inflammation. Chronic inflammation is one of the primary drivers of back pain, especially as we age. When you don't have enough magnesium, your body produces more inflammatory compounds. These compounds attack your joints, irritate your nerves, and break down the tissues in your spine. Studies have shown that people with low magnesium levels have significantly higher levels of inflammatory markers in their blood. In other words, magnesium deficiency literally makes your body more inflamed, and that inflammation often shows up as back pain. Third, magnesium is essential for bone health. We all know about calcium for bones, right? But here's what most doctors don't tell you. Without adequate magnesium, your body can't properly absorb and use that calcium. In fact, excessive calcium without enough magnesium can actually make things worse. The calcium can deposit in your soft tissues instead of your bones, leading to painful calcification. Magnesium helps direct calcium to where it belongs, in your bones and teeth, not in your muscles, arteries, or joints. Now, you might be wondering, if magnesium is so important, why isn't everyone talking about this? That's an excellent question. And here's the unfortunate answer. Magnesium deficiency is incredibly common, especially in people over 60, yet it's one of the most overlooked nutritional problems in medicine today. Let me share some eye-opening facts with you. Studies suggest that up to 75% of Americans don't get enough magnesium from their diet. But for seniors, the problem is even worse. Research shows that nearly half of all adults over 60 have magnesium levels that are too low. Why are seniors so vulnerable? There are several reasons. Number 1, our bodies don't absorb nutrients as efficiently as we age. Your digestive system changes over the years. The stomach acid that helps break down food and absorb minerals decreases. Your intestines become less efficient at pulling nutrients from your food. So even if you're eating magnesium-rich foods, you might not be getting as much benefit from them as you did when you were younger. Number 2, common medications deplete magnesium. This is a big one that many doctors overlook. If you're taking medications for heartburn or acid reflux, drugs called proton pump inhibitors like Prilosec or Nexium, these can seriously reduce your magnesium absorption. Diuretics, commonly prescribed for high blood pressure or heart conditions, cause you to lose magnesium through your urine. Even some antibiotics can deplete your magnesium stores. If you're taking multiple medications, and let's be honest, many of us over 60 are, you could be unknowingly draining your body of this essential mineral every single day. Number 3, our modern diet is magnesium poor. Decades ago, our soil was rich in minerals, and the food grown in that soil was nutrient dense. But modern farming practices have depleted our soil. Even when we eat vegetables, they don't contain the same amount of magnesium they used to. Plus, many processed foods, white bread, white rice, refined sugars, have had their magnesium removed during processing. Before we go any further, I want to pause for just a moment. If you're over 60, or if you're caring for an elderly loved one who struggles with chronic back pain, this information could truly be life-changing. I encourage you to share this video with your family members, your friends at church, your neighbors, anyone who might benefit from understanding this connection. And if you're finding this helpful, please take just a second to click that subscribe button and turn on notifications. We release new videos every week focused specifically on health issues that matter to seniors. Our goal is to give you the information your doctor might not have time to explain. All right, let's continue. So how do you know if magnesium deficiency might be behind your back pain? The tricky thing is that magnesium deficiency doesn't usually announce itself clearly. It's not like a broken bone or a fever. Instead, it shows up as a collection of symptoms that many seniors and many doctors often dismiss as just part of getting older. But these symptoms are not normal, and they don't have to be your reality. Let me walk you through 7 warning signs that your body might be crying out for more magnesium. Warning sign. Number 1, persistent muscle cramps and spasms. We already talked about back spasms, but magnesium deficiency can cause cramps anywhere. Your calves, your feet, even your hands. Many seniors tell me about those painful Charlie horses that wake them up at 2 or 3 in the morning. That's often magnesium deficiency talking. Warning sign number 2, chronic fatigue and weakness. Do you feel tired all the time, even after a full night's sleep? Magnesium is essential for energy production in your cells. Without enough of it, you're basically running on empty. Many people think their exhaustion is just old age, but proper magnesium levels can make a world of difference in your energy. Warning sign. 3. Difficulty sleeping. Magnesium helps regulate melatonin, the hormone that controls your sleep-wake cycle. It also helps calm your nervous system. If you're lying awake at night, mind racing, unable to settle down, low magnesium could be part of the problem. Warning sign. 4. Frequent headaches or migraines. Magnesium deficiency has been strongly linked to headaches and migraines. If you're experiencing more headaches than usual, especially along with back pain, this connection is worth investigating. Warning sign. 5. Numbness or tingling. This is especially important. Magnesium is crucial for proper nerve function. If you're feeling pins and needles in your hands, feet, or legs, or if you have that strange numbness that comes and goes, low magnesium might be affecting your nerves. Warning. Sign number 6, irregular heartbeat or heart palpitations. Your heart is a muscle, and like all muscles, it needs magnesium to function properly. If you occasionally feel your heart skip a beat or race for no reason, and your doctor has ruled out serious heart problems, magnesium deficiency could be a contributing factor. Warning. Sign Murphy 7. High blood pressure. Magnesium helps relax blood vessels. When you don't have enough, your blood vessels can constrict, leading to elevated blood pressure. If you have high blood pressure along with back pain, addressing your magnesium levels might help with both issues. Now, here's what's important to understand. You might have just one or two of these symptoms, or you might have several. Everyone's body is different, but if you're nodding your head recognizing yourself in these descriptions, it's time to take action. All right. Here's the good news. Restoring your magnesium levels is entirely possible, and it doesn't require expensive treatments or complicated procedures. Let me give you a practical, step-by-step approach. Step 1. Talk to your doctor about testing. This is crucial. While you can certainly start increasing magnesium-rich foods in your diet right away, it's important to know your baseline. Ask your doctor for a magnesium blood test. Specifically, ask for a magnesium RBC test or red blood cell magnesium test. This is more accurate than a standard serum magnesium test. Be your own advocate here. Many doctors don't routinely test for magnesium, so you may need to specifically request it. Explain that you're experiencing symptoms that could be related to deficiency. Step 2. Increase magnesium-rich foods in your diet. Your body absorbs magnesium best from food sources. Here are some excellent options that are easy to incorporate into your daily meals. Dark leafy greens, spinach, Swiss chard, and kale are magnesium powerhouses. Just 1 cup of cooked spinach gives you about 157 milligrams of magnesium. Nuts and seeds, almonds, cashews, and pumpkin seeds are excellent sources. A small handful of almonds, about an ounce, provides around 80 milligrams. Whole grains, brown rice, quinoa, and whole wheat bread contain good amounts of magnesium that were removed from their refined counterparts. Legumes, black beans, kidney beans, and lentils are not only great sources of fiber and protein, but also provide substantial magnesium. Fatty fish, salmon, and mackerel offer magnesium along with those beneficial omega-3 fatty acids. Avocados. 1 medium avocado contains about 58 milligrams of magnesium, plus healthy fats that are good for your heart. Dark chocolate, yes, you read that right. Dark chocolate, 70% cocoa or higher, is rich in magnesium. 1 ounce provides about 64 milligrams. Now you have a health reason to enjoy a small piece. Bananas. While not the highest source, a medium banana offers about 32 milligrams and makes a great, easy snack. Step 3. Consider supplementation, but do it wisely. For many seniors, especially those with absorption issues or taking magnesium-depleting medications, diet alone may not be enough. This is where supplements come in. But here's what you need to know. Not all magnesium supplements are created equal. The most common form you'll find in drugstores is magnesium oxide. It's cheap, but your body doesn't absorb it very well. You might only absorb about 4% of it. Plus, it often causes digestive upset. Better options include magnesium glycinate. This is one of the best forms for absorption and is gentle on the stomach. It's also calming and great for sleep. Magnesium citrate, well absorbed and often used. It can have a mild laxative effect, which might actually be helpful if you struggle with constipation. Magnesium malate. Good for energy and muscle pain, though it may be slightly stimulating for some people. Magnesium threonate. The newest form, which may have benefits for brain health and memory, though it's more expensive. The typical recommended dose for seniors is between 300–400 milligrams per day, but please, and I can't stress this enough, talk to your doctor before starting any supplement, especially if you have kidney problems or take medications. Start with a lower dose and gradually increase to avoid digestive discomfort. Step 4. Apply magnesium topically. Here's something many people don't know. You can absorb magnesium through your skin. Magnesium oil, which isn't actually oily, it's magnesium chloride dissolved in water, can be sprayed or rubbed directly onto sore muscles. Many people with back pain find that applying magnesium oil to their lower back provides quick relief. You can also add Epsom salts, magnesium sulfate, to a warm bath. This is wonderfully relaxing and can help soothe those aching muscles while delivering magnesium through your skin. A 20-minute soak in an Epsom salt bath before bed can help with both pain and sleep. Now, let's talk about realistic expectations because I want to be completely honest with you. If magnesium deficiency is contributing to your back pain, you probably won't wake up tomorrow completely pain-free. This isn't a magic pill. But here's what many people report. Within the first week, you might notice improvements in sleep quality and muscle cramps. Many people find they're not waking up as much during the night, and those Charlie horses start to decrease. Within 2 to 4 weeks, this is when people often start noticing real improvements in back pain and muscle tension. That constant tightness in your lower back might start to ease. You may find it easier to move, bend, and stand. Within 2 to 3 months, with consistent magnesium intake, many people experience significant, sustained improvements. The chronic inflammation starts to calm down. Energy levels improve. That overall sense of achiness and stiffness diminishes. Remember, everyone's body is different. Your timeline might be faster or slower depending on how deficient you were to begin with, your overall health, and other factors. The key is consistency. This isn't something you do for a week and then stop. Think of it as giving your body what it needs to function properly, something you'll continue for the long term. Before we wrap up, I need to share some important safety information. Magnesium is generally very safe, but there are some situations where you need to be extra careful. If you have kidney disease or kidney problems, talk to your doctor before taking magnesium supplements. Your kidneys regulate magnesium levels, and if they're not working properly, too much magnesium could build up in your system. If you take antibiotics, certain heart medications, or bisphosphonates for osteoporosis, magnesium can interact with these medications. It might make them less effective, or they might affect how you absorb magnesium. Take your magnesium at least 2 hours apart from these medications, and always inform your doctor. Too much magnesium from supplements can cause diarrhea, nausea, and stomach cramps. This is your body's way of saying, that's enough. If this happens, reduce your dose. Very high levels of magnesium, which is rare and usually only happens with supplements, not food, can cause serious problems like irregular heartbeat, low blood pressure, confusion, or difficulty breathing. This is why working with your doctor is so important. The bottom line, magnesium is extremely beneficial and safe for most people when used appropriately. Just use common sense, start slowly, and keep your healthcare provider in the loop. While we've focused on magnesium today, and it truly can be transformative for back pain, I want to remind you that spine health requires a holistic approach. Think of your back pain solution as a 3-legged stool. Magnesium is one leg, but you need the other legs too. We've covered this extensively, but remember, your body also needs adequate vitamin D, vitamin K2, and calcium working together with magnesium for optimal bone and muscle health. Leg number 2, appropriate movement and exercise. I know when your back hurts, the last thing you want to do is exercise, but gentle, appropriate movement is crucial. Walking, water aerobics, gentle yoga, or Tai Chi can strengthen the muscles that support your spine without putting too much stress on it. Even just 10-15 minutes of gentle stretching each day can make a significant difference. The key word is gentle. You're not training for a marathon. You're simply keeping your body mobile and your muscles strong. How you sit, stand, and move throughout the day has a huge impact on your back health. Small changes, like using a lumbar support pillow, adjusting your chair height, or being mindful of how you bend to pick things up, can reduce strain on your spine. When you combine adequate magnesium with gentle exercise and good body mechanics, you're giving your spine the best possible chance to heal and stay healthy. Section 8. Real Stories of Hope, 2030-22. I want to share a couple of stories with you because sometimes hearing about other people's experiences helps us believe that change is possible. Margaret, a 67-year-old grandmother from Ohio, had been dealing with chronic lower back pain for over 5 years. She'd tried physical therapy, pain medications, and even considered surgery. She was taking over-the-counter pain relievers almost daily. When her doctor finally tested her magnesium levels, they were significantly low. She started taking 400 milligrams of magnesium glycinate daily and began soaking in Epsom salt baths 3 times a week. Within a month, she noticed her back pain had decreased by about half. After 3 months, she was able to stop taking pain medication completely. She still has occasional discomfort, after all, she's not 25 anymore, but the chronic daily pain that had dominated her life was finally gone. Then there's Robert, 72, a retired construction worker. Years of physical labor had taken a toll on his back. He was skeptical about just a mineral making any difference, but his wife convinced him to try. He combined magnesium supplementation with the foods we discussed earlier and continued his gentle water aerobics routine. He didn't experience overnight results, but gradually, over about 6 weeks, he realized he was sleeping better and waking up with less stiffness. The constant muscle spasms in his lower back had virtually disappeared. These aren't miracle stories. They're examples of what can happen when you address a nutritional deficiency that's been undermining your health. My friends, we've covered a lot of ground today, so let me bring this all together for you. If you're over 60 and you've been struggling with chronic back pain, muscle spasms, or that constant feeling of stiffness and achiness, please don't resign yourself to thinking this is just what getting older feels like. Yes, our bodies change as we age, but persistent pain is not something you have to simply accept. Magnesium deficiency is incredibly common in seniors, yet it's rarely the first thing doctors investigate when you complain about back pain. This one mineral plays a crucial role in muscle relaxation, inflammation control, and bone health, all essential factors in spine health. The warning signs of deficiency, muscle cramps, fatigue, sleep problems, numbness, and tingling, are often dismissed as normal aging, but they're not normal. They're your body's way of telling you something is missing. The solution is straightforward. Increase magnesium-rich foods in your diet, consider high-quality supplements after talking with your doctor, and perhaps try topical magnesium for direct relief. Be patient with the process. Give your body 2 to 3 months to restore its magnesium levels and start repairing the damage that's been done. Combine your magnesium intake with gentle exercise and good body mechanics for the best results. Most importantly, be your own health advocate. Request that magnesium test. Ask questions. Don't settle for, "It's just your age," when there might be a real, addressable cause for your pain. You deserve to move freely, sleep peacefully, and enjoy your golden years without constant pain holding you back. And sometimes the answer is simpler than we ever imagined. It might just be giving your body the essential nutrients it's been lacking. If you found this information helpful, I have a favor to ask. First, please hit that subscribe button and click the bell icon so you don't miss our future videos. We're dedicated to bringing you evidence-based health information specifically for seniors, the kind of practical advice that can truly improve your quality of life. Second, share this video with someone you care about. Maybe it's a friend who's always complaining about their aching back, a sibling dealing with chronic pain, or your children who are concerned about your health. This information could make a real difference in someone's life. Third, I'd love to hear from you in the comments. Are you dealing with chronic back pain? Have you ever had your magnesium levels tested? If you try the strategies we discussed today, please come back and let us know how it goes. Your experience might inspire someone else to take action. And remember, we have many more videos covering important health topics for seniors, everything from heart health to diabetes prevention to staying mentally sharp as we age. Take a look at our channel and find the information that matters most to you. Thank you so much for spending this time with me today. Take care of yourself, be well, and I'll see you in the next video.